Good dentures can change lives. When Julie got her first set at 18, she at last felt free to smile.
It was like somebody had opened the door, like turned the light on, and I started to get people saying, "Oh, you've got lovely teeth," and that's something nobody had ever said to me before. It was just great. I just couldn't stop smiling then.
Here you go.
But good dentures take time to make. These films show the work of Dr. John Besford, a prosthodontist with a referral practice in London's Harley Street. He gives frequent seminars for the whole dental team and helped develop the Enigma denture system.
Well, I mean, they don't look alien.
No, they look very natural.
Good. I'm going to shorten them rather than raise them, because to get a bit of wear. That's one of the commonest things that is wrong about dentures. They're set up as they come from the manufacturer, and in fact most people's teeth have wear.
Though his practice is specialist, there is much to learn from his experience and techniques.
That's the beauty of the thermoplastic materials. You can go on correcting them until you're really happy. In the way I work, there are all sorts of little details, little helpful hints, little ways of proceeding, which anybody who has the slightest interest in making good dentures can benefit from.
The film for clinicians goes through every stage of the process. Dr. Besford gives tips on making primary impressions, including what he calls the French impression.
If you don't have a good denture to copy, then the next best thing, particularly for people with very poor lower ridges, is an impression which is made by the patient in their own mouth with no tray at all.
He explains how to make good working impressions.
We're going to try and produce an impression which has a very thin labial flange, because the bone resorption, it doesn't really take place at the top, and therefore I believe you should have a very thin top to the labial flange here. With a not very careful impression, the denture border will finish well short of the top of the sulcus, and the air is waiting just here to get in.
He suggests ways of calculating the size of the front teeth.
Oh yes, oh it's wonderful. This has all the information we could possibly want. It will allow us to calculate the size of the teeth, to choose teeth of exactly the same shape and size. I can calculate the size.
He demonstrates the use of magnets to improve upper denture retention.
These won't provide very much resistance to lateral movement, but they will provide quite a lot of retentive force. The magnet is 1.1 thick, so we've got nearly 2 millimeters thickness of acrylic.
He points out the advantages of checking speech early, while the wax rim is still easy to change.
30. You keep stopping before 6, which is what I really want to hear.
36.
Yes, it's a bit closed in.
36.
36.
He shows when and how to use the Gothic arch technique.
Sometimes it's very difficult for a patient to find their way to that back position with the lower jaw as far back as possible. And that is the position at which we need to get a biting record of how the jaws meet.
And he demonstrates the use of the face bow.
Slide the jig onto the face bow fork, and then I raise this till this little arm lines up with the mark I made on the face.
He gives advice on choosing colour.
Do you think that's a good colour match, Ruth?
Yes, it is. It's very good.
Dr. Besford uses Enigma teeth and gingival colour tones to achieve a high standard of naturalism in both teeth and gums.
These gums look so real.
In the film on laboratory procedures, Ruth Burke, one of the best denture technicians in the world, shows the finer points of denture construction.
I give just the 8 anterior teeth, because if you had the 6, you'd have the a wax rim in the smile.
Yeah.
So the 8 takes you kind of around that corner, and you can get a good idea of the aesthetics.
The film is full of handy hints for making dentures look and feel real.
I now use the electric wax knife and just add some wax, bringing what I call an S-curve over the mesial aspect of that tooth. I pull a floss between the teeth, and then I pull it across and back so you can actually form the papilla in between there. So you just brush the flame slightly over the wax, not melting the gingival roll, and then press the sponge in to the softened surface, and then a light flame over the surface brings up the mottled effect. On the Rouget, you can use the paintbrush to just precisely move the colour.
Okay, so tell me.
The film made for patients shows how to help the clinician so that together they get the best possible denture. It gives an idea of the many clinical and laboratory steps which are needed to produce high-quality dentures, most of which the patient would never normally see. The combined input of all members of the dental team and the use of the very best materials means the patients get what they really want.
The other ones came like a sort of block of cinema seats.
Yes.
These are individuals.
Yes, those are
Nice.
individuals, that is right.
They're lovely.
It's me. You've got me back.
The patients programme is short enough at 16 minutes for waiting room viewing or for the patient to take home. The clinicians programme, in 3 parts totalling 80 minutes, gives tips and hints on a wide range of clinical procedures. And the technicians programme, in 2 parts totalling 40 minutes, explains how laboratory techniques can be adapted to today's cosmetic world. They are available separately on VHS or all on one navigatable DVD. Educational credits may also be available. Please contact the Shotlander distributor in your country or contact Shotlander direct on www.shotlander.com. Shotlander, who developed the Enigma denture system, has been providing quality teeth and products for making dentures since 1922.